we're going to do the room scan. Table. And my ears. I'm going to plug in my laptop. Okay. Good morning. My name is M.Morris. I'm a nurse practitioner student at Auburn University. And today we're going to do an HEENT with musculoskeletal exam. This is Ashley, who will be our patient today. When entering the room, I did hand hygiene with the sanitizer. Ashley, can you tell me your name?
Ashley.
And what year is it?
2023.
Where are we right now?
Tallahassee, Florida.
And who's our president?
Biden.
Good deal. So she is alert and oriented ×4. Her speech is clear and coherent. She appears to be in good health and good spirits. There's no signs of distress. Her skin is pink. It is warm to the touch and dry. She is average height, thin in stature. She is healthy looking, definitely not obese. And she is an adult female, normal development, as I can see. Her posture is upright, slightly slouched, but her motor activity was good. She did ambulate in here with a steady gait today. She is dressed appropriately for the weather today. And so now we will go on to her skin and nails, which we will do throughout the whole video. There's no obvious rashes or redness, no lesions. Her fingernails are well groomed. There is less than 3 second cat refill. No clubbing or cyanosis. Skin turgor, there is no tinting. She is well hydrated. We will go on to the HEENT portion. We'll start with her hair. It is evenly distributed. It is color treated. It's very pretty. It is coarse, not very thick, but not thin either. No lesions or anything on her scalp. Her head is normocephalic. There are no indentions or depressions, no infestations or lice. So now we will start with your face. Let's do cranial nerve 7. So smile, frown, puff out your cheeks, and raise your eyebrows. Now close your eyes and then try to open. Good. So that cranial nerve is intact. Then we will go on to your sinuses. We'll palpate. Is there any pain? No. All right, we'll percuss. Does that feel okay?
Mm-hmm.
Good. So sinuses are non-tender, frontal, and maxillary. Palpate T and J. Use clench. Can you open? Good. A little popping. But was there any pain with that? No? Okay, good. So TMJ feels good. Cranial nerve 5 is intact. We will check the 2-point discrimination. So close your eyes for me and tell me if this is soft or sharp.
Soft. Sharp.
Good deal. Okay. So cranial nerve 5 is intact. So now we will move on to her lymph nodes. So pre-auricular and post, occipital, anterior cervical, posterior cervical, and your tonsils, submandibular, submental, and your supraclavicular. Now all of those are mobile and discrete. Was there any pain or tenderness?
No.
Good. So non-tender lymph nodes all over. So onto your eyes. The sclera is white. Conjunctiva is pink and moist. The cornea is intact. Her eyes are a bluish green. There's no redness or swelling. Lacrimal glands. Any tenderness there?
No.
Perfect. And there is also no swelling. For the visual acuity, we're going to use our small Snellen chart. Just hold this 14 inches and read the lowest line that's clear.
LTFPH.
Perfect. So that is 20/20 with both eyes. For the purpose of this video, we will just do that, but you would typically do each eye separately after that. So now we are going to use our ophthalmoscope. Let's turn on. And look straight ahead. So the direct light is visible from the nasal to pupils and bilaterally. I'm going to go ahead and check your pupils now. Good. All right. So pupils are equal, round, reactive to light. That is cranial nerve 3. So then we will do the 3, 4, and 6 with points of gaze. Follow my finger and don't move your head. And then in. Perfect. So that is intact. And there was also accommodation, and there was no nystagmus or lid lag. So now we will look at the anatomy of the eye. So just look ahead. Bear with me. It's bright. All right. So with the anatomy, I don't see any hemorrhages in the retinal background or exudates. The macula and fovea centralis is visible. The optic disc was round and yellowish in color and defined, so everything was normal on this exam. So now we're going to do confrontation. Can you cover your right eye? And then tell me when you see my fingers.
No.
Okay. And the other one? Again?
No.
Good deal. So visual acuity is good. There are no deficits there. So we'll move on to her ears. Just inspecting first. There's no redness, no visual drainage, no swelling. Everything looks good. Are you having any pain in your ears? No. Okay. So I'm going to look now with the otoscope. So up and back. So small amount of honey-colored cerumen. There is a pearly white tympanic membrane. There is no redness or swelling or drainage, and no foreign bodies. Along with your ears, we are going to do the Weber and Rhine. So I'm going to place this on top of your head. Tell me if you can hear it bilaterally, okay?
Yes.
Good. So that was good, all normal. And now we'll do the Rhine. So I'm going to place this behind your ear and tell me when you can't hear it anymore. No. And now.
No.
Good deal. Good hearing. So the air conduction was longer than bone conduction, which is normal. Lastly, we're going to do the whisper test. So I'm going to whisper something and you just let me know what you hear, okay? Auburn. Good deal. So that is good. Now we will move on to your nose. So upon inspection, it is symmetrical. There is no swelling. Any tenderness? No. Good. So that all looks good. Looking in your nose. The septum is midline. Sorry. All right, so it is pink. There is no drainage. I don't see any polyps. The turbinates look good. There's no swelling. So can you close your eyes again for me? And tell me what you smell. Alcohol. Good deal. So olfactory is intact. That's cranial nerve 1. And then could you cover one of your nares and breathe in? Perfect. So their nares are patent, and again, we would do that bilaterally. So her lips are dry, but they are not cracking. There's no edema. They are pink. Can you open your mouth? Mucosa is pink and moist. Tongue is pink. Look in here. All right. So her teeth, not missing any teeth. There's no dental caries or cavities. Her palate is intact. And one more time, can you open and say ah? So uvula does raise when she says ah, which is cranial nerve 9. And can you swallow? Perfect. So that's part of cranial nerve 10. We are not going to do the gag reflex for this video, but we would typically do that next. So her pharynx looked good. There was no exudate, no swelling or redness. and her tonsils were present, but they were not swollen and there were no abscesses. Excuse me. So now onto her neck. It is symmetrical. There does not seem to be any lesions or scars or redness. Excuse me. Sorry. So let's test your range of movement in your neck. Can you go side to side, ear to shoulder? Good job. And then chin to chest, head all the way back. Perfect. Do you have any pain?
No.
Great. So full range of motion there. Shrug up for me. Perfect. So that was a 5 out of 5 strength, and that is also cranial nerve 11, or part of it. You turn against my hand, and then this way. Perfect. So cranial nerve 11 is intact, and there was 5 out of 5 strength in her neck as well. And can you turn up for me so I can check your trachea and your thyroid? All right, so trachea is midline. There is no deviation. All right, can you swallow? Perfect. So the thyroid was palpated. It does rise when she swallows, and there were no borders present. So moving on to musculoskeletal. So I'm going to check your pulses. Brachial, popliteal, posterior tibial, and dorsalis pedis. So all of the pulses are 2+, which is normal. We would also check the femoral pulse. But for this video, we are going to bypass that, but it would also be 2+. Sorry. And while we were doing the femoral pulse, we would also check inguinal nodes, and they should be non-tender and mobile. So now we are going to check all your joints. So let's start with your arms. Can you raise them up? All right, and then back. And then behind your head. Perfect. So when you move, do you have any pain in your joints or anything? No. Okay. So there's no edema present. Seems to be good range of motion in her arms. We would do this bilaterally. And while we're doing this, we're also inspecting her skin for edema, redness, warmth, swelling, things like that. All of that is negative. So let's do your hands. Spread your fingers for me. Good. Clench your fist. Flex up, down, and then rotate. Perfect. So there is full range of motion in her hands and fingers. Can I get your grip strength? Perfect. And then hold your elbows up like this. Push and pull. All right. So there is 5 out of 5 strength in grip and her elbows. For your legs, let's go straight out and back in. So your joints feel good. Any pain? So non-tender, no crepitus. Range of motion seems good here. Can you push up for me and push out? So 5 out of 5 strength there as well. Let's lay down. Perfect. And we are going to now check your hips and your pelvis. So can you bring your knee to your chest? Any pain?
No.
Good. All right. Now bring this up, and we're going to go out and in. No pain?
No pain.
Good. So full range of motion there. Raise up against. Good. So 5 out of 5 strength. And now we will go to your feet. Push. Oops. Push and pull. Good. So 5 out of 5. Now point your toes. And then go side to side. And then come back. And around. Perfect. So full range of motion in her ankles as well. Now we're going to stand. And I'm going to check your spine. So bend forward for me. And I'm going to palpate the spine. Patient does not seem to have scoliosis. Stand up, twist, and then bend side to side. Perfect. Any pain there?
No.
All right. You can have a seat. So I believe that concludes our video, and thank you so much.